Hi, I'm Dr. Joe Alukal. I'm a urologist on faculty at Columbia University Irving Medical Center, and I'm going to be answering questions today about every guy's favorite topic, male infertility. I know this is a scary term for people to hear. It shouldn't be as frightening as you think it is. It's important for patients to know that they're not alone and that we have solutions for the problems that many of our patients come in with. In most cases, this is a very treatable condition. Today, I'm going to try and answer for you some very common questions that I get asked all the time by my patients regarding male infertility. Honestly, the truth is that there's lots of people who have these issues. They just tend not to speak to each other about it because of some of the embarrassment that's involved in this condition. 1 out of every 6 couples approximately who are going to have trouble conceiving when they try to start a family. Of those, about half of them, there's going to be an identifiable problem with the male patient. And in many, many cases, those problems are fixable. A Western diet does appear to predispose us to certain dietary deficiencies that might predispose to infertility. And there is good science that suggests that there's ways to circumvent that. And we can certainly talk about that in a visit if it's an appropriate intervention to suggest to a patient. So I'm always trying to remind people that starting a family is a good time to learn healthy habits in terms of lifestyle, and moderation is always a good suggestion, certainly when it comes to alcohol intake. I remind people that regular exercise has tremendous health benefits in addition to helping to offset some of the ways that people become infertile. And certainly I can consistently suggest to people that either cigarette smoking or marijuana is not going to help them in terms of their likelihood of having a baby. It's not something where I want to preach to people about these kinds of issues or get people feeling badly about them. I just want to remind them that learning some healthy habits now is a good idea. Unfortunately, there's no guarantees of anything. The odds are pretty good that the interventions we're offering people are going to help them in terms of their numbers, but we can't guarantee that couples are going to be able to get pregnant, obviously. How quickly will they work? Generally speaking, these are the types of treatments where I have to remind people that the human body takes almost 3 months to make new sperm. So if we were to do surgery on someone tomorrow, I can't expect that the day after that there's going to be a meaningful improvement in his sperm count numbers. So I do have to ask patients to be patient when we are talking about these kinds of interventions. So my hope in answering these questions for you guys is to let you know that male infertility is much more common than people realize, but it is in many, many cases a very solvable problem. It's nothing that you need to be afraid of. It's nothing to be ashamed of or embarrassed about, for certain. If you think you may have an issue with male infertility, don't be afraid. Throw on your best sport coat, flash a big grin, come on into a doctor like myself to learn more about what the solutions to these sort of problems are. No matter what, you're going to be the same confident, stylish guy you've always been. Don't worry about this somehow reflecting negatively on you. These are common problems, and we just need to figure out how to solve them. Being a man is actually confronting these issues, coming in and getting them taken care of. Sometimes there are health issues underlying the problems you may have that you need to know about in order to stay healthy, and that your loved ones want you to find out about so they can keep you around. So especially when you're getting ready to start a family, why not start that off on the right foot, making sure that you have a clean bill of health and making sure there's nothing for your loved ones to worry about in terms of your health.